So we've heard that pancreatic exocrine insufficiency, or PEI, is a real problem for people who have loss of pancreatic function. And the question then is, what can we do about it? Because it really is unpleasant not to be able to absorb food, to have malabsorption and maldigestion. Well, part of the solution is the way that we eat, because as you can imagine, if the pancreas is not able to produce enough enzymes to digest the food, then the excess will run through the bowel more rapidly. If we eat small meals and eat them more frequently, then there's a better chance that the small amount of enzymes and fluid and bicarbonate produced by the pancreas will actually be enough to help digest that meal and will overcome some of the problems related to malabsorption and maldigestion. However, in many people that's not enough, and so what we have to do is try and replace the enzymes that the pancreas is not able to produce. This is called pancreatic enzyme replacement therapy, or PERT, and it is possible, and has been for many years, to get pancreatic enzyme replacement medications, so-called digestive supplements, and these are capsules or tablets that contain the enzymes that would normally be produced by the pancreas. So we have enzymes called amylases that break down carbohydrates, we have lipases that break down fats, and we have what are called tryptases, chymotrypsin and trypsin, that break down protein into the components. So it's possible to take these enzyme supplements with the meals so that they mix with the meals and the enzymes get mixed with the food as it goes through the small bowel, and that then supplements the digestion that has been affected by the loss of pancreatic function. And if the amount of enzymes is tailored to the requirements of the individual patient, then what happens is they can work out how many of these capsules, for example, they need to take with each meal to ensure full absorption of the food, to ensure that they no longer are malnourished, and to control the diarrhea and steatorrhea that they have. So with a combination of smaller, more frequent meals, taking the enzyme replacement therapy capsules mixed in with the meals, so eat a little bit, take a capsule, eat a bit, take a capsule, it's possible to return digestion almost to normal. However, that isn't the only thing that we need to do, because as we heard before, if there's malabsorption, there is also potentially loss of some of the important vitamins. So not only is it important to eat small frequent meals with the enzyme replacement therapy, it's also important to make sure that people with chronic pancreatitis and PEI take the vitamin supplements and mineral supplements that they need to maintain full health. So there are clearly a lot of symptoms that can go with pancreatic exocrine insufficiency. Often when people get symptoms, they think that it must be related directly to the pancreas. And whilst it is possible that pancreatic inflammation, whether it's acute pancreatitis or chronic pancreatitis, can produce pain from the pancreas itself, many of the symptoms that people get with PEI are because of the malabsorption of food, which then leads to the rapid transit, the gas, the bloating, and the cramps. And that's more related to diet, and this can be managed by close attention to diet and pancreatic enzyme replacement therapy, rather than worrying that the pain is an indication of continuing damage to the pancreas itself.